Welcome to part 1 of Lysosomal Storage Diseases. Let's get started. In this video, we'll be discussing Tay-Sachs disease, Niemann-Pick disease, Fabry disease, and metachromatic leukodystrophy. Let's start with Tay-Sachs disease. Tay-Sachs disease is an autosomal recessive condition caused by a deficiency of hexosaminidase-A. In this condition, GM2 ganglioside can no longer be converted to GM3 ganglioside, so GM2 ganglioside builds up in the lysosomes. The clinical presentation is characterized by neurodevelopmental delay. These patients also have a cherry red spot on the macula, which is due to lipid accumulation in the ganglion cell layer. Patients have hyperreflexia, but no hepatosplenomegaly. This is in contrast to patients with Niemann-Pick disease who do have hepatosplenomegaly. Tay-Sachs disease is also characterized by an excessive startle response. Finally, electron microscopy shows onion skin lysosomes. This is a fundoscopy image showing the cherry red spot on the macula, and we can see this cherry red colored macula right here. The cherry red spot on the macula is not pathognomonic for Tay-Sachs disease. It's present in all lysosomal storage diseases that affect the central nervous system, and it can also be present in central retinal artery occlusion. The management of Tay-Sachs disease is primarily supportive with the aim of alleviating symptoms. For example, we can use antiepileptics for seizures. However, the prognosis is poor despite interventions, with most patients dying by the age of 5. All right, now let's move on to Niemann-Pick disease. And with regards to this topic, we'll be discussing the general features, clinical presentation, and management. Niemann-Pick disease is an autosomal recessive condition caused by a sphingomyelinase deficiency. Sphingomyelinase normally converts sphingomyelin to ceramide. Therefore, Niemann-Pick disease is characterized by an accumulation of sphingomyelin. The clinical presentation is characterized by neurodevelopmental delay. Hepatosplenomegaly is present in this condition, which is in contrast to Tay-Sachs disease, where hepatosplenomegaly is absent. Patients with Niemann-Pick disease have a cherry red spot on the macula on fundoscopy as well. Foam cells, which are the lipid-laden macrophages, are characteristic of this disease. Here we see the microscopy image showing foam cells. All right, let's try a question. A 4-year-old girl is brought to the physician by her mother due to irritability and an inability to speak. She was born at 39 weeks of gestation via vaginal delivery. Physical exam shows hepatosplenomegaly, decreased sensation on her upper and lower extremities, and +1 deep tendon reflexes. Fundoscopic exam shows relative pallor of the retina compared to the normal red color of the macula. What will most likely be seen on light microscopy of this patient's tissue biopsy? All right, this patient presents with an inability to speak, decreased sensation on her upper and lower extremities, hypoactive deep tendon reflexes, and hepatosplenomegaly. Involvement of both the central nervous system and the reticuloendothelial system is characteristic of Niemann-Pick disease. As we discussed on the previous slide, light microscopy of the tissue from a patient with Niemann-Pick disease will show foam cells, that is, sphingomyelin-laden macrophages, which is the answer to this question. The management of Niemann-Pick disease is mostly supportive with physical therapy. Miglustat is a medication used in certain types of Niemann-Pick disease, and this medication is an enzyme inhibitor. However, it's not routinely administered. Okay, let's move on to Fabry disease. Let's start by discussing the general features. Fabry disease is an X-linked recessive disease caused by a deficiency of alpha-galactosidase-A. This normally converts ceramide trihexoside into glucocerebroside. Therefore, Fabry disease is characterized by an accumulation of ceramide trihexoside. Fabry disease has an early and late phase. The early phase consists of peripheral neuropathy, which is commonly described as burning hands and feet. It's also characterized by angiokeratomas and hypohidrosis. The late phase, on the other hand, is characterized by renal failure and cardiovascular disease. Here's an image of angiokeratomas, which are classically seen in Fabry disease. The management includes replacement of alpha-galactosidase-A, dialysis or renal transplantation for chronic kidney disease, and the pharmacologic management of heart transplantation for heart failure. All right, let's try another question. A 5-year-old boy is brought to the physician by his mother due to a rash on his face. She first noticed the skin lesions several months ago, and they have enlarged since then. The patient complains of burning sensation in his hands and feet. The mother reports that her son does not sweat as much as her other children after playing outdoors. The physical exam shows erythematous papules most prominent on the cheeks. Involvement of which two organ systems is most likely expected in this patient? All right, this is a 5-year-old boy presenting with erythematous papules on his face. which is most consistent with angiokeratomas. He also has a burning sensation in his feet and hands, which is suggestive of peripheral neuropathy. And finally, he has decreased sweating, which is known as hypohidrosis. This triad is characteristic of early phase Fabry disease. As we discussed in one of the previous slides, the late phase of Fabry disease is characterized by renal failure and cardiovascular disease. Therefore, these two organ systems will most likely be affected in this patient. All right, now let's move on to our final topic, metachromatic leukodystrophy. This is an autosomal recessive disease caused by an aryl sulfatase-A deficiency. Aryl sulfatase-A normally converts sulfatides into galactocerebroside. Therefore, metachromatic leukodystrophy is characterized by the accumulation of sulfatides, such as cerebroside sulfate. The clinical presentation is characterized by central and peripheral nervous system demyelination, ataxia, and dementia. Management includes enzyme replacement therapy with aryl sulfatase-A. All right, let's wrap up with one final question. A 4-year-old girl is brought to the physician by her parents because she has had difficulty walking for the past 2 years. She used to speak several words, but now she does not talk at all. A skin biopsy reveals cellular accumulation of cerebroside sulfate. Which enzyme is most likely deficient in this patient? All right, this patient has had difficulty walking and she does not talk at all, even though she used to speak several words. Regression of gross motor and verbal skills are suggestive of nervous system involvement. These findings, in combination with cellular accumulation of cerebroside sulfate, are highly suggestive of metachromatic leukodystrophy. Let's recall that cerebroside sulfate accumulation in metachromatic leukodystrophy is due to a deficiency of aryl sulfatase-A enzyme, and this can cause demyelination of the central and peripheral nervous system. So the answer to the question is aryl sulfatase-A. And that concludes this section.